NPseal is a negative pressure wound dressing that is used on incisions that's been closed, and I use it on all of my robotic surgery incisions that are bigger than 2 centimeters, as well as for pilonidal cystectomy incisions that are closed. My name is Dr. Anna Serur. I'm a chief of colorectal surgery at Englewood Hospital and Medical Center. Most of the dressings are very cumbersome. They're very expensive. Patients are very dissatisfied because there's a lot of beeping, noise, failure of the dressings to work, which leads not only to patients not using them, but a lot of phone calls to the physicians. With an NPseal, it's a very simple device. It really is very user-friendly. I show the patients how to use it, and I haven't had one patient have a problem, including 99-year-olds. And patients love it, and as physicians, we love it because it leads to better cosmetic outcomes, less infection rates, less seroma formations, and less phone calls. When I see the patients about 3 to 6 months later after the surgery is performed, I can barely see the scar. So if you look at the data that shows the cost to the hospital when the patient develops a wound infection, it's significant, especially if it leads to either ER visit or potentially hospitalization after the surgery is done. So taking into consideration that cost, the cost of NPseal is really minimal. I strongly recommend NPseal to all of my patients, and actually a lot of my colleagues. I've introduced orthopedic surgeons, plastic surgeons, breast surgeons, gynecologists to this device. I'm really excited because of the outcomes that I see in my patients, and I think that really most of the specialties can use it.